Male genital physical examination. Step by step. Preparation. Assessment of the penis. Assessment of the scrotum, inguinal area, prostate examination, rectal examination. Analysis of the data. Preparation. The necessary materials prepare, including gloves, gown, and penlight. Ensure the privacy of the environment. Explain the procedure to the man. Clear communication with patient about examination process builds trust and cooperation. Give the man an apron to put on. Help the man lie down on the table. Give him the position and cover him up. Clean gloves are worn. Assessment of the penis. Perform the inspection while the nurse is seated and the man is standing. Examine penile root and pubic hair for growth pattern. Potential infection sites. Skin condition at root. Areas to check for erythema. Examine the skin circumference, check on the shaft for erythema, lesions, swelling, and nodules. Check if the foreskin is present and for color, location, and integrity. If circumcised, ask the man to retract his foreskin for fingers and thumb. Examine the glands for morphology, including size and shape. Check for inflammation or ulcers. Location of the meatus urethralis on the glands. Palpate the shaft for indurated or tender areas. Assessment of the penis discharge. Gently squeezing the glands between the index finger and thumb. Apply pressure from base towards meatus. Observation of urethral opening for any discharge. Assessment of the scrotum. Penis is held out of the way and examine size, shape, and position. Look for swelling, lumps, or bulges. Check for scrotal dimension. Left testis often lower or larger than right testicle position, and asymmetry in testicular descent is physiological. Check for shape characteristics. The scrotum is gently palpated. Upwards to check for unilateral swelling or inflammation. Spread the skin folds of the scrotum to perform a close inspection. Examine the skin for color, integrity, and the presence of lesions or rashes. Also, lift the sac to examine the posterior skin. Palpate the between the thumb and the first 3 fingers. Testis palpation and assessment areas. Epididymis location. Spermatic cord palpation path from testis upward. Palpate of the testis. Palpation each testicle separately with both hands. Place your thumbs on top of the testis. Gently roll the testis between your thumbs and fingers to examine it. Look for size, shape, consistency, and the presence of tenderness or nodules. The spermatic cord and vas deferens are also palpated for abnormalities. Varicocele. Look for nodules, swelling, or tenderness. Palpation of the epididymis. It is carried out starting from the upper part and working towards the lower part. Palpate the spermatic cord and vas deferens and look for nodules, swelling, or tenderness. Fluoroscopy, the scrotum. If a mass or swelling is detected, transillumination of the scrotal contents is performed to observe for a red glow inguinal area. Common pathologies: testicular tumor, hydrocele, fluid varicocele, epididymitis. Examination of inguinal area. Give supine position. Examine the man for femoral and inguinal hernias. Look for bumps, protrusion, and thickening. Shift the man's weight to the left to palpate the right groin. Place the index finger in the right scrotum and press upward on the slit-like opening of the external inguinal ring. Check if there is pain. Valsalva maneuver. With the finger in the inguinal canal or outer inguinal ring, ask the man to push down or cough. Feel for any sudden pressure or lumps hitting your finger. Repeat the procedure for the left side. Prostate examination. Sims position is preferred during prostate examination. Index, finger of the dominant hand may be used for deep palpation. Prostate should be palpated anterior to the rectum. A normal prostate is small, smooth, and symmetrical. In enlarged prostate, the prostate enlarges diffusely and the surface is regular. In nodular prostate, the surface is irregular, and the nodules should be evaluated for malignancy. Rectal examination. The patient should be positioned on the examination table with forearms placed on the table and feet shoulder-width apart. If standing is not possible, the patient should be placed in the left lateral position. The person should be covered, and only the examination area should be open. Patient privacy must be respected. The area between the sacrococcygeal region and the perineum should be examined. The sacrococcygeal region should be inspected for fistula and pilonidal sinus. In the perianal region, the following should be assessed: hemorrhoids, fistulae, lesions, signs of infection, anal sphincter examination. The finger is inserted into the anal sphincter and the patient is asked to squeeze. Analysis of the data. Completion of examination. Inform the patient that the examination has ended. Provide a towel for cleaning and covering. Allow privacy and time for dressing. The obtained data are recorded. Nursing diagnoses, actual potential, and wellness are formulated. If necessary, appropriate referrals are made.